control transfer procedure. Now, stimulus control transfer procedures sound intimidating. I'm telling you, they're not. What it really is just fading a prompt, okay? Now, when we prompt, what are we doing? Well, we're delivering a cue or a signal to engage in a response, and that prompt becomes a temporary SD. So we deliver our SD, and in between that SD and the response, we have a prompt, right? A temporary SD. We want to transfer control from the prompt to the SD. And that's all it is. We're transferring control over a response from one stimulus to another. It's very straightforward, okay? Don't let the technical term intimidate you, right? All you're doing is taking one SD and transferring it to another, that control, okay? So for our answer here, that's what we're looking for, a situation where we have one SD that has control over a behavior, and we're trying to transfer that control to another. So A, you lay out a field of 3 cards. You tell the client, touch blue. The client touches blue, and you deliver a token in praise. Are we transferring anything here? No, this is a straightforward discrete trial, right? You have your SD, touch blue. The client engages in the response. You reinforce. Very straightforward discrete trial. No transferring going on. B, you show your client a picture of 3 blocks stacked in a shape and tell them, copy this. You then build what is on the card, and the client copies what you built. Is there any transferring going on here? No, it's just a simple prompting procedure, right? You show your client the picture. You tell them, copy this, your SD. The prompt is your model of what is built on the card. The client responds. Now, if you transfer control from your model to copy this, now we're talking, right? Now we're transferring control. But all we're doing in B is simply delivering the prompt. Okay, no transferring going on. C, your wife always says, turn the oven off when you're done cooking. She now says, did you forget something? Okay, now we have the SD. All right, turn the oven off. You respond by turning the oven off. Now she wants the oven being turned off to happen in the presence of, did you forget something? She wants to transfer stimulus control from turn the oven off to the less invasive, did you forget something? And to eventually where you're just going to turn the oven off without any of these verbal cues, right? So there is transferring going on. This is a good representation of a stimulus control transfer procedure, right? We're not sure if it's effective. Doesn't really matter. The question just wants to know what best represents a stimulus control transfer procedure. So far, C is our best answer. And on the exam, that's how you have to think about it. You're just looking for the best answer based on the information given, all right? Don't overthink it. Just give them the best answer based on what they ask you. So D, you no longer deliver attention to a client when they flop to the floor and roll under the table. This sounds more like extinction than anything, right? We're not transferring control of anything. It sounds like we're withholding reinforcement for flopping under the table. So we can eliminate D. Our best answer of trying to transfer control from stimulus to stimulus is C, from the SD of turn the oven off to the SD of did you forget something? Again, very straightforward. Don't overthink stimulus control transfer procedure. What reinforcement schedule produces a scallop effect? You just need to be ready for these type of questions on the exam. They want to know what reinforcement schedule produces the slot machine effect, what produces the scallop effect. They just like these kind of questions. And remember, there are a lot of questions on this exam. Not every question is going to be the hardest question you've ever seen. So when you get an easy question and you know the answer, pick the best answer, move on. Again, no overthinking. So what reinforcement schedule produces a scallop effect? Well, scalloping, right, is just a pattern of response where responses, there's a pause after where reinforcement is delivered and there's a pause after that reinforcement, okay? And then after a time passes, there's a rapid rate of response. And why does that occur? Well, because the scallop occurs when? For a fixed interval schedule. And why is that? Well, think about how a fixed interval operates, right? If we're on a fixed ratio and it's an FR5, we know we have to engage in 5 responses for reinforcement. So if I do my 5 responses very quickly, I'm going to get reinforcement quickly. If I'm on an FI, though, let's say an FI 5 minute, it doesn't matter how quick I do my responses, I still need to wait 5 minutes. And that's where the scallop comes in. After I get reinforced, I know I have to wait another 5 minutes for reinforcement. So I might wait 3 or 4 minutes before starting to respond. And that's where our scallop comes into play. Okay. So the FI, the fixed interval, produces this scallop effect. VR, of course, is our slot machine effect. And then the VI kind of helps solve this issue of the FI because now it's random. We don't know when the time is going to be up. So we need to be a little cautious when using an FI. We need to avoid this scallop effect, which sometimes it's better to use the VI because then we can avoid some of this scalloping, right? Where the client is able to know and predict how much time passes. Oh, I have to wait 20 minutes for reinforcement. There's no point in me even responding until, 15, 16 minutes have passed. Okay. So the reinforcement schedule that produces the scallop effect is the fixed interval schedule. Jen, a BCBA, is pleased with the RBT's ability to take data. Each time she collects IOA data, the RBT data matches what Jen records. Jen neglects to analyze the RBT's data or take IOA data for 3 weeks. When Jen checks the data, there is a huge discrepancy between the data from 3 weeks ago and current data. When Jen asks the RBT if anything has changed, the RBT says no. What might explain the discrepancy in the data? So Jen makes a pretty common mistake for BCBAs where you have an RBT that you really trust, and you have maybe some other cases that you're paying more attention to, and you just neglect some things, right? It happens. It's a mistake. It can be fixed, okay? But Jen comes back and sees her data is all messed up, right? It looks nothing like it did 3 weeks ago. The RBT says nothing has changed. I don't know what's going on. When you read this question, if you've been studying, there's a couple things that come to mind, that should come to mind, okay? You want to get to the point where you're attacking these questions. You read the question stem and you start attacking what they're asking you, okay? So if I look at A and B, this is what comes to my mind: treatment drift or observer drift. We can eliminate C. RBT laziness is never going to be one of our answers for obvious reasons, right? We're never going to blame it on quote unquote laziness, an unobservable, unmeasurable thing. And then attrition is losing participants in a study, which is irrelevant. Again, though, attrition, if you're not familiar with your terms and definitions, might look promising, which again is why you need to be familiar with your terms and definitions. So we eliminate C and D. That leaves us with A and B. What is the difference between treatment drift and observer drift? Well, the primary difference, in my opinion, and how I think you should think about it is when you're dealing with treatment drift, you're dealing with the intervention, okay? What are you implementing? When you're dealing with observer drift, you're dealing with data, okay? You can take good data if your treatment's drifting, right? You might be implementing the wrong treatment, but your observation's correct, okay? However, with your observation, your observer drift, even if you're delivering the right treatment, if you're not taking the right data, then your observation is drifting. So in this case, are we dealing with intervention or data? Well, we're dealing with data. The question says data about 100 times, right? It appears observer drift is the cause here, okay? Treatment seems to be going fine because Jen likes what's happening, right? She has IOA data for 3 weeks from 3 weeks ago, and all of a sudden the data just is off, okay? Most likely how the RBT is observing the behavior of interest has changed. Therefore, the data is shifting. So what might explain the discrepancy in the data? Probably be observer drift because we're dealing with the data and the measurement and not the actual treatment itself. What is not a major difference between respondent and operant behavior? Read this carefully, okay? These not questions can be confusing. What is not a major difference between respondent and operant behavior? Essentially, what it's saying is there are 3 examples of major differences between respondent and operant behavior, okay? So you have to be careful about this not word, okay? It throws people off. So let's find our major differences between respondent and operant behavior. A, how consequences impact behavior. Are consequences different for operant and respondent behavior? Absolutely. Think about your contingency. The respondent contingency is what? Stimulus response. Operant behavior is what? Stimulus response stimulus, ABC. Consequences play a huge role in operant behavior, not so much in respondent. So A is definitely a major difference. Remember, we're looking for one that is not a major difference. B, how contingencies are defined. Well, we just went over it. What is our respondent contingency? The SR, the stimulus response. And then we get operant behavior, which added the consequence part, right? Stimulus response stimulus. So are contingencies defined differently? Absolutely. Okay. This is the major difference. Again, B is out. C, the voluntariness of behavior. Respondent behavior, okay, quote unquote, classical conditioning, typically deals with involuntary responses or reflexes, sneezing, sweating, that sort of thing. Operant behavior typically deals with more, quote unquote, voluntary behavior, right? Things we can control, things we learn, things we unlearn, all right? Not these reflexes, okay, that are innate. So the voluntariness of behavior is certainly different. That leaves us with D, the observability of the behavior. When we talk about respondent, are we talking about private events? Well, can you see someone sneeze? Yes. Can you see someone sweat? Yes. Can you see someone cry? Yes. Operant behavior, of course, is observable, right? Measurable, because operant behavior, when we deal with operant behavior, we're dealing with those public events, okay? So the observability of the behavior is not really a major difference between respondent and operant behavior. And while we consider private behaviors, okay, typically we're going to talk about observable behaviors. Respondent behaviors are just as observable as public operant behaviors. So out of all these, what is not a major difference is going to be D, the observability of the behavior. A teacher hands out a worksheet to his class. He tells the class he must step outside to take a call, but will check back in 10 minutes. If at least 70% of the class is engaged with the task when he comes back, they will receive a reward. What type of recording should the teacher use to track engagement? All right, be careful here. How is the teacher going to know if the class is engaged, if he's going to take a call and is going to be gone for 10 minutes, right? He says he's coming back and is going to check who's engaged with the class. He needs at least 70% of the class, right? So he needs a percentage, which means he's going to count how many are engaged and find a percentage. What type of recording should he use? Should he use partial interval? Well, partial interval is a discontinuous measurement, but you still need to observe throughout the entire interval, which he is not doing, right? Same with whole interval. Yes, discontinuous, but still during the interval, you must observe. He's not observing. He's coming back after 10 minutes and quickly seeing who is and who isn't engaged. So play check, okay, a planned activity check. This is when, after a set interval, you check on the group and you count how many people are engaged with the activity. It's exactly what's happening here. Play check is a type of momentary time sampling. It's a type of discontinuous measurement. This is the best type of tracking or recording he should use. Okay. And then duration is obviously wrong for a variety of reasons, but most importantly, it's continuous. Duration, you need to take duration data continuously. So throughout the entire class, he's taking it for a short interval, and he's only observing at the very end of that interval and observing the entire group. So he's using a planned activity check or play check. After explaining to a parent what consequences are, the parent tells you that they always make sure they are reinforcing their child with praise and love. They tell you they praise their son when he does the dishes, but he still rarely, if ever, washes the dishes. Based on this information, praise for the dishes functions as what? Common scenario. Either parents say, well, I punish my child, or they say, I always deliver reinforcement. But as behavior analysts, what are we concerned about? Are we worried about the topography of the consequence? Not really, okay? We want to know what effect does that consequence have on the future behavior. And if the parent is praising the son, but nothing's changing, he still rarely does the dishes, right? Nothing's changing. Is praise a reinforcer? Now, it's a consequence, but is it a reinforcer? No, right? We're only worried about how it affects future behavior. The behavior is not changing at all. And if the behavior isn't changing, then it's not going to be reinforcement or punishment. So A, reinforcement we eliminate. Behavior is not maintaining or increasing. B, behavior is not decreasing. It's just not changing at all, right? He still rarely does the dishes, no matter if they praise him or not. It has no impact on him, okay? So it's a consequence in the sense that it follows a response. It just has no effect. So therefore, it's C, it's neither reinforcement or punishment. D, not enough information. We have plenty of information to answer this question, so D is not our answer. Pretty straightforward reinforcement punishment question. If this one gave you trouble, go back and review reinforcement and punishment. I have a very long video on my channel about reinforcement and punishment. But remember, the main idea is to determine if something is reinforcing or punishing, we look at its impact on future behavior. If behavior is not changing, it's not a reinforcement or it's not a reinforcer or a punisher. You're a BCBA who works at a local ABA clinic which focuses on children with autism. Your friend calls you and tells you her son was just diagnosed and she would like you to refer her son to your clinic and to take on the case. What is the most appropriate response to your friend? This might start happening to you a lot, okay? When you tell people what you do, or when your friends know what you do, okay, because things like autism are very prevalent now, they might come to you for help. In those times, no matter how difficult, right, it might be because it's emotional or you're very close to this person, we have to remember our ethical code. We just do, right? That's what makes us professionals. So in this case, what do we say? Okay, our friend comes to us in need. How do we respond? A, tell her you will refer her son and you will work with them. Do you work with your friend's kids? No. Why? Dual relationships. Dual relationships are professional and personal boundaries crossing. We don't want to mix the two. If you work with your friend's kids, you already have a personal relationship. Okay, that line has been crossed, right? You cannot work with them. B, tell her you will refer her son, but you cannot work with them. Can you refer her son to your clinic? Sure. You just cannot have involvement in the case. You can still refer because you want to help her find services. You just cannot take any stake in that case at all. Okay. So B is an appropriate response. Do we have a better one? Always read all of your answers. C, work with her son as a private contractor. Well, definitely don't do this, right? Because now you're very much in that dual relationship conflict of interest territory. We want to avoid working with him at all. And then D, tell her you can't refer her son and you cannot work with them. No, again, you can refer her son. Totally fine. We want to help as many people as we can. You just have to avoid dual relationships and ethical violations. So it's going to be B, tell her you will refer her son, but you cannot work with him. Susie is playing with her Barbie dolls when her big sister walks in the room and tells her to get dressed because they are going to the store. Susie starts to cry and scream. Susie's dad walks in and says, after we go to the store, we get to go to the movies, but we need to go shopping first. Susie's dad is using what? Okay. So again, attack the question. What terms are coming to your mind? Don't be intimidated by the exam, all right? I know the pass rate. I know what people say. It's all based on the task list, okay? If you know your terms and definitions, you're 80% of the way there. Now we just need to apply them, okay? There's nothing new on the exam that you don't know based on the study guide. So if Susie's dad says, hey, first, we need to go shopping, and then we're going to go to the store, and then we're going to go to the movies, what do you start thinking? Well, I start thinking contingency. I start thinking Premack principle, right? Premack principle, using the opportunity to do something as a reinforcer for something that is less likely to occur. So these are the terms that are coming to my mind. So now I have a plan going to the answer choices, right? So when I see a bribe, is he bribing her? Well, a bribe is a reverse contingency, right? A bribe would be, okay, we're going to go to the movies and then we go shopping. That's not what dad said. Dad said first we go shopping and then the movies. So dad is implementing the contingency properly. B, the Premack principle, exactly what we predicted, right? The opportunity to engage in a lesser preferred activity to be reinforced with a more preferred activity, which is exactly what's occurring here. B looks like our answer. What about C, differential reinforcement of other behaviors? Is dad reinforcing in the absence of behavior? No, right? He's just simply setting up a contingency. And then functional communication training. Are we teaching to ask for wants and needs, verbal operants? Nope. Susie's dad is simply setting up this contingency using the Premack principle to effect. So our answer here is going to be B, the Premack principle. It is 11 p.m. and you have work in the morning. You are at a sushi restaurant with all your friends and someone orders sake bombs. You say, all right, that's my cue, and start to leave. Your friends say, come on, just one shot. What is most likely the function of your behavior? Now, why do your friends say, come on, just one shot? Well, chances are in the past, that's gotten you to stay, right? So in the past, come on, just one shot, right? Is that SD for, okay, I'll take one shot. Now we're going to have a good time. Okay. But that's not what the question is asking. What is the question asking? The question is asking, what is the likely function of your behavior? It's an important tip. We need to answer what the question is asking, not what we think it's asking. So attack it, right? But attack it the right way. And if you attack it the right way, it's a very easy question, right? What is the function of your behavior? Are you trying to obtain a tangible? Clearly not, right? You're trying to get away as fast as you can from this tangible. So are you trying to escape? Yes, right? Escape, escape. You're trying to get out of this situation. Okay, you're trying to escape this sake bomb because, right, you have to work in the morning. You're being responsible. Okay, so B is most likely our answer. Attention. Are you trying to get attention? It doesn't seem like it, right? It seems like you've been there the whole time with your friends, enjoying yourself, right? And only when the sake bombs were ordered did you try to quote unquote escape. Automatic, this is socially mediated, so of course it's not going to be automatic. What is the most likely function? B, escape. A student stands up and walks around the room at inappropriate times. You decide you are going to deliver reinforcement on an FI3 reinforcement schedule for the student sitting in their chair. If the student gets up and walks around, no reinforcement is delivered. What type of procedure is this? Okay, think about this, right? It's a differential reinforcement question. First thing we need to ask ourselves, are we teaching a replacement behavior? If the answer is yes, then we can quickly eliminate some of our differential reinforcements. What differential reinforcement interventions teach replacement behaviors? Well, DRI and DRAs. Which ones don't? DRO doesn't. DRL and DRD don't. And DRH don't. So are we teaching a replacement? Yes, right? What do you want them to do? You want them to sit in their chair at appropriate times. So now the question becomes, are we reinforcing a behavior that can occur at the same time as the old behavior, or reinforcing a behavior that can't occur at the same time? Can you stand up and sit down at the same time? Can you walk around and sit down? Nope. Those are what? Those are incompatible. Therefore, we are using a DRI, a differential reinforcement of incompatible behaviors. Okay, hope you enjoyed. Please like and subscribe. BCBAstudy.com for all of our study materials. Please check that out. Any questions, comments, let me know. Work hard, study hard. See you soon.